I'm Dr. Anthony Cave, your Stanford and Harvard trained anesthesiologist and integrated medicine specialist. And today I'm going to share a pretty touchy story about a patient of African descent who came in with a sickle cell crisis. So, just to recap, this involves patients of African descent because sickle cell disease is more likely to occur in patients from that part of the world who have those genes. It's nothing about discrimination racially, it's about a fact about statistical probability and that those patients are at high risk of not receiving the health care that they deserve. Sickle cell disease can cause incredible physical and emotional pain, and most providers are not empathetic or sympathetic enough. And it allows victimization to completely sabotage patients, even in surgery in the operating room, when you're under anesthesia, connected to the ventilator with the oxygen mask on. And we're going to talk about how that is and what you can do to help get yourself out of the rut of self-victimization. This patient had come in with, like I said, a sickle cell crisis. They had always come in with pain in their chest area. It's because of the risk of vaso-occlusive crises that sickle cell disease confers, and it can occur anywhere in your body. It happens to be more common in your chest area and really any long bones. In this patient, it was in their chest. They probably had this pain every day. They come into the emergency room and they're complaining about pain in their chest. I don't mean complaining in a dismissive way. That's unfortunately a word that's used in the medical lexicon. It's not the right word. I apologize actually for using it. I should have said they came in because of pain in their chest. See, I fell into it just as much as anyone else would. Hey Cheryl, I'm happy to hear that you found the channel. Okay, so the patient comes in with this pain and they insist, Doc, I'm always in this pain. It's the same pain. I've always had pain here. It's always the pain. It's the same pain. The family also emphasized, oh, Doc, it's just the same vaso-occlusive pain, what they used to call a pain crisis, which is a terrible word. We'll talk about why. It's always the same pain. It's their same pain. Treat their pain, Doc. Well, I did treat their pain, but a very astute nurse noticed that the patient was also peeing blood. And the nurse told me, they said, hey, Dr. Cave, the patient has blood in their urinal. Why is that? So, long story short, there had been so much emphasis on the pain, the chest pain, the same chest pain that I always live in, the same chest pain, doc, that they always have. The family's iterating it, reiterating it. The patient is digging deep into it. Not because they're faking it. This is real pain. It has become such a deep narrative that they didn't even mention that they had pain in their flank, meaning the area back here, which is where the kidneys were. They ended up suffering papillary necrosis of their kidney. It had already happened when they came in, to be clear. But they were so fixated, and I don't mean it to be very clear, it's not blaming. There had been so much emphasis on the nerves that fire together, wire together, right? This has become such a victimized narrative that it wasn't until after I asked them, do you have any pain in your back? They said, oh yeah, I did have pain in my back before I came into the ER. That demonstrates the power of distraction that arises, one of the many problems when we fall into roles of self-victimization, either from ourselves or by those that love us and care for us. So what happened is that they not only had a vaso-occlusive pain crisis in their chest area, which is very common, but also in their kidney. And that had caused part of their kidney to die, papillary necrosis, but it had not come up. And until the astute nurse had noticed it, we would have not even found it. There isn't a ton you can do because it had already been too late, but it shows just how damaging victimization can be. So when you're under anesthesia, this victimization can persist and can cause all sorts of complications. When you're under anesthesia, you know the thoughts that you have before you fall asleep can heavily influence where you end up after you wake up. When we fall into self-victimizing roles, we are more likely to wake up with those self-victimizing thoughts. When patients fall asleep under anesthesia, if they are already engaging in cognitive distortions, especially black and white thinking and prophesizing or fortune telling, they are more likely to fall into catastrophic thinking or catastrophizing. Catastrophizing has a clear association with worse pain after you wake up from anesthesia. So you fall asleep on the table here and you're already thinking, what's going to happen after I wake up? It's going to be terrible. I'm always in pain anyways. My back always hurts. So I'm going to be in even more pain once the surgery on my knee is done. This is a daily occurrence in my patients. So when patients are falling asleep and they're already predicting how they're going to wake up, then they are set up for worse pain after they wake up. When you wake up in more pain, you get more medications. When you get more medications, you have a higher risk of side effects. So what are you going to get? You're going to get more gas, potentially. You're going to get more of the vials that I no longer have here to show you. More fentanyl, potentially more midazolam, more Presidex, more ketamine, more Demerol. You're going to get more medications. You're going to be at risk of having more side effects. When you go home, you're going to get higher risk of having kinesiophobia. The more anxiety we bring into the operating room, the higher the risk of anxiety in daily activities after we wake up from surgery. What does that mean? It means that you might be afraid of moving, especially if your surgery involved a particular limb that you had pain in before. When we get so wound up in a narrative of, I'm hurting, I'm always in pain, I have always been abused by those around me. I'm not condoning people doing wrong things to my patients. Absolutely not. But we need to recognize, and this is where it gets touchy, we can be empowering in how we speak with patients while also not fueling past narratives. They don't need to go together. There's a difference between acknowledgement and progressing versus acknowledgement and perseverating. This is where my patients can have either so much suffering or can begin a new story after they wake up from anesthesia. And I hope this is clear because this can be a night and day difference. After you wake up on this table, it can be the same surgery, same day of the week, same time of the day in two different patients, but then mindset of I'm always in pain, I always suck at this always kicks my butt. This is what patients tell me, anesthesia kicks my butt. They're more likely to wake up with nausea and side effects because they may have needed more anesthesia because that self-victimization winds up the brain in ways that translate to needing more sedation or more pain medications. So when they go home with that kinesiophobia, they are more likely to develop surgical site infections. They're more likely to go home and end up with complications like frozen joints. They are more likely to end up with other infections like a pneumonia or even a blood clot leading to a pulmonary embolism. What do these all have in common? When we have kinesiophobia from the fear of worsening our situation because we've already been prophesizing our future pain. I'm always in pain, doc. I'm always nauseous. It's always painful transferring onto the gurney. I can never walk on my own. I can never walk on my own without help after surgery because I'm always so weak. I'm not saying these have not happened in the past, and we need to be empathetic and compassionate. But the more we dig into these narratives to victimize ourselves, we are simply manipulating ourselves, just like that patient who came in saying, I always have this same pain in my chest from my sickle cell. Well, it distracted from the kidney, and in these patients, it distracts from waking up empowered, distracts from self-healing. It distracts from having a sense of fulfillment and direction, having a passion to take care of ourselves when we're so hell-bent on perseverating and ruminating over past events. And this is touchy because I know that it is so hard when we have been neglected, when we have been emotionally or physically abused. It's so hard to break away from these self-defining identities or these powerfully ingrained and meshed identities. It's very hard, and I'm not saying this is easy, and I'm not saying it's right if this has ever happened to anyone. But I do also say that we need to not dig in our heels and accept the fates that we have, unfortunately, for any number of reasons, been brought into. Like Rachel says, think of a lovely memory before going under, and for the days and weeks before you go under. Exactly. A little bit more to come, guys, but if you wouldn't mind hitting that like button, if you appreciate me coming in here after a long day in the operating room, if you learned something, please share with others to help empower others. We're going to talk about ways to escape victimization in yourself and in others. And if you appreciate this topic, I always encourage you to leave a comment below about what you want to hear about, and to also fill out the polls that I put up regularly. And if you could hit that like button and subscribe to keep up with all my lives, it helps me do this more often. We want to avoid doing any product placement because I believe that the best way for you to be healthy is for you to gain this knowledge about the great healing powers that you have in conjunction with the best of Western medicine. So back to victimization. We know that victimizing helps enforce past narratives, which are true and painful and physically affect the body because we see it in surgery. The body keeps score, no question. How do we escape? There's many ways. There's as many ways as there are human beings on this planet, which is one of the beauties and elegances of how our mind and bodies work. Of course, one way is through psychedelics and through ketamine, how I help my patients in my ketamine infusion clinic to achieve persistent changes in self-representation. Anything that can break the connection between trigger and behavior, that is how we can unmesh our identity from that past trauma that we're victimizing in. Psychedelics, by inducing neuroplasticity, can allow for rewiring to occur to, in some ways physically and neurochemically, break that or disrupt that connection from trigger to behavior. So perhaps the trigger was, oh, I'm having surgery, I'm always in pain. Well, the trigger is having surgery, the behavior is the thought, that victimizing thought that I am always in pain. I am always mistreated because the doctors and nurses don't care about me. They never listen to my story. They always leave me without adequate pain medications. I'm always nauseous. No one listens to what I have to say. They every single time ignore what I'm telling them after the recovery room. They always treat me like a meat bag, etc. I have heard all of these with the same black and white type of words. Every single day I have heard these. And it's not going to stop anytime soon because this is how our brains react in stressful situations. That's why we need a way to literally rewire and symbolically rewire the trigger to the behavior. So no, we shouldn't do psychedelics in everybody. Absolutely not. And ketamine is not right for everybody. Meditation is a powerful way. There's many ways of approaching meditation, some helpful, some less helpful. We have other videos on that, but this is an example of a natural way, right? Cognitive behavioral therapy, very powerful. Right for some people, not right for other people for any number of reasons. But what you can do is to recognize that when somebody is coming to you pushing, I don't mean pushing in a disrespectful way, but bringing up a history that is clearly enforcing self-victimization, it doesn't help to put them down, right? My tendency sometimes when they're like, "Doc, I'm always in pain after surgery," it's not to make fun of them, nor is it to engage them in it beyond gathering what has led to their past trauma that has led to their self-victimization. So it's a fine line, and I hope that if you ever have a doctor, you feel comfortable to help break this cycle by engaging your doctors. When you feel that might be blowing you off, "Hey, doc, can you please listen to me?" You know, a patient actually told me this on Friday. They were so frustrated and fed up. They said, "Doctor, I don't think you're listening to me." Now, I was totally taken aback, and I have to do a whole video on this, but I applauded that patient. I said, hey, thank you for speaking your mind. Because you, instead of enforcing the self-victimizing narrative, "Nobody ever listens to me," he spoke up and he told me, "Doc, I don't think you're listening to me." Boy, did that get my attention. Now, I'll explain why that came up in a different video, but that is how we can begin to lift ourselves up and change the narrative. It's not always that easy. Of course it's not always that easy. It's really, really hard. And I have had patients with terrible, horrible histories and narratives and experiences that make the hairs on the back of my neck go up. Abusive parents, traumatic physical injuries, emotional pains from traumas that I could never imagine. I am not downplaying what they've gone through at all. I'm impressed that half of them are still alive to tell me the story. But I'm not impressed by the subset that continue to live through their story without trying to lift themselves up. That is the difference that respectfully and with full compassion and curiosity, patients can bring up with their doctors, and doctors need to bring up with their patients. Because if we engage in self-victimizing behaviors, we may not be as helpful to patients as we could otherwise be. We may not be helping them appreciate their inner healing potential, instead keeping them stuck in past situations. Lee T.H. is saying, you're never going to fix vulnerable narcissists. That's developmental. And in some cases it might be. But we can't not try. Because certainly from my experience, many patients can, like the patient that I just told you about. But we should not stop for lack of trying. For lack of trying. Texas Red Robin says it's what's in your soul. Yeah, there's many things that go on within our hearts, brains, minds, souls, spirits, whichever resonates with you. I do want to say that blaming doctors and nurses is one of the surefire signs that someone is in a victimizing mindset. You know, the doctors never listen to me. The doctors never give me enough pain meds. The nurses are always rough with the catheters. These are just some of the many examples that I've heard. And it's always a tip-off that someone has had a bad experience likely in the past, and it could be a sucky experience. A traumatic catheter insertion when you're awake, a urinary catheter, can be really painful. But ruminating on that past pain every single time is going to sensitize you to pain in the future. Versus being like, hey, nurse, I've had a really bad insertion in the past. Can you please be mindful either with your lidocaine jelly, ask a urologist to do it, ask the doctor to do it, whatever. That is lifting oneself up and not playing the same narrative repeated in the head to risk more pain from coming in the future. When the doctors never get enough pain meds, instead of throwing it out there, doc, I never get enough pain meds. Doctor, what are you going to do to help ensure that I'm not going to wake up in pain? And that if I do, I know you're going to help me as fast as you can. Do you see the difference between the self-victimizing that just gets repeated and blames other people versus taking responsibility and even delegating responsibility to others? You as a patient should be empowered to delegate to others. You shouldn't feel shy about asking for things. We are here to help you. You are not here to victimize yourself. You are here to heal and also feel empowered to do so. So I hope that everyone is better equipped to identify self-victimizers out there, not to be manipulated by them. Otherwise, they might end up hurting themselves, just like that first patient we started off with. Remember, everyone, if you appreciate my time in here after a long day in the OR, please hit that like button, share with others, and remember that you have more power over your health than you have ever been told. Until next time.